My name is Jacqueline Pei. I'm an associate professor in the Department of Educational Psychology, and I'm also a practicing clinical neuropsychologist. So I have been working at the University of Alberta for about 7 years now, and prior to that I worked in purely clinical practice neuropsychology and had the privilege of working largely with individuals affected by an FASD. Largely in diagnostic capacities, but also in providing intervention services. Since starting work at the University of Alberta, I've had the opportunity to blend that clinical work with research to help improve the way in which intervention services are provided to individuals with an FASD. I got my start working with individuals with an FASD in a really different way. My first degree was in criminology, and I worked in forensic settings, providing intervention services to youth and adults convicted of significant or serious offenses, and found in those settings a lot of them were not all that responsive to traditional models of support and intervention. This is in fact what really took me back to school, where I did my graduate training and pursued more inquiry into why is not all these folks within this kind of setting responsive. Why is the traditional treatments and the approaches that seem to make sense for most people not effective for all people? And that took me into the study of neuropsychology, and really the crossover between neuropsychology and brain injury and forensics happens to be in large part FASD, as this is a group that not only present with a significant brain injury, but also due to the impact of this brain injury tend to engage in a lot of behavior that gets them into trouble and lands them in jail or other settings, mental health settings, or settings that are not conducive to good outcomes in their life. And so we're looking for alternatives, and we're looking to see what alternative approaches we might take with this population to improve those outcomes and change the trajectories and change the life course away from this. And we know it's not working in some of the traditional models. We know we have to think a little bit differently and think outside the box a little bit more than we have in the past. These kids, these youth and these adults, they have potential and they have strengths and they have a lot of assets that we can build on. We just need to figure out how to find them and how to capitalize on them, and then what to do next. The work I do currently still continues to be much of it clinical, but in terms of the research component, a lot of the work either is geared towards developing interventions that can be used directly with youth, adolescents in particular, to help improve their ability to function, but also working with systems of support. So working with justice organizations, correctional facilities, educational institutions, to say how can we as systems of support better meet the needs of these populations? What can we do differently? If something's not working, rather than simply blame the individual, how can we reframe our approach, rethink the way that we're doing things in order to come at the problem a different way and see greater success in the population and essentially capitalize on their strengths and their abilities so they can go on to have successful lives. We are working in a number of research initiatives all over Alberta, all over Canada, and all over the world, depending on the different initiatives. Alberta is a real leader in terms of providing intervention supports to individuals with an FASD, and we can be really proud of the way we have tackled this issue and really seen success in the work that we're doing here in the province. As such, the rest of Canada has stepped on board and is modeling a lot of the approaches that we've initiated here. And recently, internationally, we've seen other countries also step on board. And so it's really exciting to see the work that started here in Alberta really expanding to something that has international recognition. We're seeing interest in the work we're doing throughout several countries in Europe, interest in the work we're doing in African countries. Ghana is looking at some of our initiatives and implementing them. We're seeing interest in our work in Australia. Australia is really making some big advances in terms of intervention supports for FASD, and we've been working very hard to broker partnerships between Canada and Australia, as well as a number of European countries and some specific African countries. And Ghana, Nigeria as well have been two real leaders in Africa. FASD is a concern anywhere you have women who can become pregnant and women who can consume alcohol. Anywhere those two things occur, which is potentially any country in the world, you have a possibility of FASD occurring. Anywhere where we have women becoming pregnant, we need to be thinking about what it means to have a healthy pregnancy. We need to be thinking about what it means to support women in a way that is conducive to making decisions during their pregnancy that are healthy. And that requires a high level of support. It's not as easy as simply saying, don't drink during pregnancy. Women who consume alcohol in pregnancy do so for many reasons, and they're complex, and they're usually embedded in the social fabric of that country and that community they live in. So it's a big issue that has implications around the world, where you see women, babies, and alcohol. I think when we're working with individuals with an FASD, it's crucial that we work together. I think it's crucial that we're communicating and we're talking to other folks, because this can be hard work and challenging work, and we're not in it alone. I think that we need to be adaptive and flexible in our approaches, and remember, this isn't about us, it's about the individual we're working with. This isn't about my personal pride, it's about how I can best understand the needs of the individual I'm working with in order to respond appropriately. I'm the one that needs to be flexible, I'm the one that needs to be adaptable, even if it's not always comfortable for me to do so. I think, thirdly, that strength-based is crucial. I think we really need to recognize strengths. We talk a lot about brain injury and disorder and deficit when we talk about FASD, but we need to also remember we're talking about human beings who have strengths and abilities, and it's those strengths and abilities that create their foundation that we can then build on. We build on those strengths and we will have a solid foundation to grow from. And it may look very different than a typical foundation in somebody we're working with. But just because it's different doesn't mean it's not a strength that we can really harness and support. So I think working together, working adaptively, and working with those strengths best equips us to support this population. I think this is an incredibly rewarding and fantastic group to work with. I think we just have to be prepared to be flexible and really meet these folks where they're at. And when we do, the rewards are abundant, and it's just fantastic work.